Mitral valve is the valve between the left atrium and the left ventricle. So, the left atrium is the upper chamber on the left side of the heart. Left ventricle is the lower chamber on the left side of the heart. So, the one which is in white here with its connection to the left ventricle. So, this is the mitral valve. So, this mitral valve regulates the flow from the left atrium to the left ventricle. So, there are two different types of mitral valve diseases. One is this valve opening can be narrowed. So, narrowing of the mitral valve orifice is called mitral stenosis. This orifice can be leaky and it can get enlarged. So, that is called mitral valve regurgitation. Mitral valve can be affected by three major disease processes. One is a rheumatic mitral valve disease, which is an infective cause of the mitral valve. The other is a degeneration of the mitral valve with aging. So, with progression of age, because of the wear and tear of the mitral valve, this mitral valve can get damaged. The other common problem which is afflicting the mitral valve is a degeneration due to myxomatous changes. That is what we call as the mitral valve prolapse or Barlow's disease. So, these three different types of mitral valve involvement can lead to different types of pathologies. So, rheumatic mitral valve disease usually presents with mitral stenosis, but at times it can present with mitral regurgitation also. Whereas mitral valve prolapse presents with mitral regurgitation only. Whereas degenerative mitral valve disease usually presents with mitral regurgitation, but in a certain percentage of people can present with mitral valve narrowing or mitral stenosis. In rheumatic mitral valve disease, there is an infection of the joints. Rheumatic means joint disease. So, there is an infection of the joints that will go and afflict the heart because of a immune phenomenon. So, whenever there is an infective disease that can affect the joints and the heart, that problem is called a rheumatic heart disease. This can be either stenosis or a leaky valve or a regurgitation, also called as a regurgitation. This usually rheumatic problems present at a much younger age, usually between the 20s to 40s, or at times between 18 to 40 years of age. This rheumatic mitral valve disease happens. Contrary to rheumatic mitral valve disease, degenerative mitral valve disease is a disease of the aging. In this disease, what happens is there will be progression of calcification. Calcification means that is like these structures in the heart, they become more like a rock because of accumulation of calcium. So, whenever there is an accumulation of the calcium, that can extend from the base and progress into the valve and causing a limitation of the movement of the valve. So, usually when there is a limitation of the movement of the valve, there will not be adequate coaptation or coming together of both the leaflets. When there is an inadequate contact between the leaflets, that will cause a leaky valve. So, degenerative mitral stenosis, mitral disease usually presents with a regurgitation and very rarely with a stenosis. In a mitral valve prolapse or a myxomatous mitral valve problem, what happens is the valve leaflets, which are normally very thin, they become thickened more than 4 millimeter or 5 millimeter in thickness. So, whenever there is a valve which gets more thickened, once again there will be a gap between the leaflets causing a mitral regurgitation, because one valve can be irregularly or irregularly thickened, whereas the other valve will be thickened in a different pattern. So what happens is there will be a gap between the leaflets in a myxomatous valve or a mitral valve prolapse.